Think prevention, live long.
This video is going to explain you the atrial fibrillation. Atrial fibrillation is one of the common conditions where upper part of the heart is contracting at a very rapid rate, and that rapid rate leads to stagnation of the blood in the upper part of the heart, and that can lead to clot buildup in the heart and can cause stroke. So that's the reason we worry about atrial fibrillation, because stroke is a very common concern. Atrial fibrillation typically happens in people who already have heart disease, for example, long-standing high blood pressure, heart valve problems, heart blockage. But sometimes atrial fibrillation will happen in young people without any obvious heart disease. Once I say that you have atrial fibrillation, we'll make sure that it's not tip of the iceberg, it doesn't represent any more heart issues. So we will go ahead and order some proper testing, including an ultrasound of the heart, a 24-hour monitor if necessary, where we monitor every heartbeat for 24 hours. And 24-hour monitor will tell us that if you have atrial fibrillation, how rapid your heart is beating, and in case if you have any slow heart rate. Many of the patients with atrial fibrillation will have tendency towards going very rapid and at times going very slow, and we call it tachybrady syndrome. So some of the patients with atrial fibrillation will end up needing actually pacemaker. And the reason I mentioned that, because many times we will be using medication to slow down your heart rate, and when we use those medicines, sometimes it will slow down enough that we will be worrying about blackout and passing out type episode. So you know, some of the people with atrial fibrillation will end up needing a pacemaker to control or to prevent the slow heart rate, and the medication to prevent or control the fast heart rate. So it's a combination of pacemaker and the medication. The Coumadin, the blood thinner, would be one of the very common medicine we use in atrial fibrillation. We have this system, or a scoring system I should say, where we kind of decide whether you need Coumadin or not once you have atrial fibrillation. And that system we call CHADS, C-H-A-D-S, CHADS system. And I'll explain obviously details about CHADS system, but not every patient with atrial fibrillation will need Coumadin. If you need Coumadin, we have very organized system in our office to monitor the Coumadin very closely. But you need to be also equally part of the team, because once you're on Coumadin, it's a big responsibility both for the patient and the doctor and my office. So if I put you on Coumadin, have your blood drawn on a regular basis when we ask you. You will have a standing order typically, so you don't have to take a lab slip with you. You will just go to the lab, they will draw the blood for you, and then they will call us with the results. I ask you and I insist you that go for the blood draw before 10 o'clock in the morning, because that way we will have the results by 2 o'clock in the afternoon, and then we can call you, because typically I would ask you to take the Coumadin at night. So we want to reach you before we go home the same evening of the blood draw you had. So if you have blood draw done late in the afternoon, then we cannot reach you that night because labs will not be back. So please make a case to go before 10 o'clock in the morning, and obviously rare exception will be okay. Typically I ask you to have your blood drawn Monday to Thursday, because Friday, Saturday and Sunday our office is closed and we will not be able to reach you if you have your blood work done on Friday. So try not to do Friday, Saturday, Sunday unless I specifically ask you to do it, and if that's the case, I'll personally be calling you at home because my staff will be off those 3 days. Atrial fibrillation is a very benign condition in general, very common, very simple, and we know how to manage it very well over the last many years. So I don't want you to be afraid or worried about the condition. At the same time, it requires a lot of coordination together. I'll give you some additional material to read about atrial fibrillation, read about Coumadin. Please take the material home, read it in details, write down questions if you have, but be part of the team again for atrial fibrillation. So let's sum it up. Atrial fibrillation is the irregular heart rhythm from the upper part of the heart. The main concern is the stroke. We will be looking why atrial fibrillation happens with different testing. Sometimes people with atrial fibrillation will require a pacemaker. Coumadin is a common therapy we'll be using. So if you're on Coumadin, please be very responsible part of the team. And obviously I'll be always available to you to talk to you in any details you need. So let's just work as a team together. Thank you.
When we think prevention, live long, the heart of mid-Michigan strong.